I got involved with the amyloidosis research consortium we actually started it in 2015. And it's because I was diagnosed 20 years ago with AL amyloidosis, which is a type of amyloidosis. And at that point I was diagnosed, and has been since, there are no treatments for this disease. And there's very little awareness and support for research, so we really felt there was a need to found an organisation that could do that. So it actually started, I've been involved for 20 years with different organisations, and originally with myeloma foundations, and then for 10 years I was on the board of the Amyloidosis Foundation. And out of that we realised that because there are a number of drugs that are in clinical trials at the moment and are struggling with trials, we needed to have a much more focused mission, and so we kind of formed a sister organisation to the Amyloidosis Foundation to really further the research and look for advanced diagnostic tools and things that can actually help drugs successfully be developed. Interesting, we're at this pivotal moment in time where we've suddenly realised that patients should be at the centre of drug development, and it's, you know, it's such an obvious line, and yet it's something that's just come into our language. Like, that's been the biggest discovery of the last decade, is patients. And so it's really, it's massive. It's not just that you have, you know, patients who are speaking up, who are advocating, who can be articulate about the needs for patients, about the needs for funding, about the needs for investment. But actually it's looking at the fact that patients need to be part, and are becoming part, of every moment in the drug development continuum, from early design right through to the end product. And this realization that actually patients are the ones who can tell you what they need. There's no point designing the new hottest Porsche and putting wooden seats in it. That's not going to sell. So it's really understanding what are the needs of the patient community, what is their disease burden, what is their quality of life, what is the risk benefit that they are willing to take. And that then should be what informs the drug process, rather than, you know, the basic researchers and industry coming up with, oh, we have an idea, this is what patients want. And throughout, and making the federal agencies understand that what is important for patients when they're evaluating a therapy. What matters to you if you are sick? What risks are you willing to take? What are you not willing to take?